Hi from Joy Wellness Partners and Enliven Aesthetics. I'm Carol Bender, nurse practitioner and the owner of the clinics here. And I'm here with Kim Kovarik, nurse practitioner. And we're both originally ER before we came to become nurse practitioners in regenerative medicine. And today we're kind of breaching the idea that possibly regenerative medicine could be the answer to the opioid crisis, the opioid epidemic right now. So Kim, do you want to give a little background as to what this whole concept is?
We just wanted to touch this topic because we see opioid addiction as a huge problem in the practices that we've worked in before.
Yeah.
And a regenerative clinic, we see all kinds of patients that are here for pain treatments, and we offer a different kind of treatment. So it's an alternative to the addiction crisis that's out there.
Yeah.
And without ruining people's lives.
That's really what brought us to where we are today. Can you tell me a little bit about what you see in the ER? Like, what's a day in the life look like for a patient?
Well, it depends on the patient, that's for sure. But, unfortunately, the ER is not the primary best place to get pain management treatment. And we all know that. It's a quick fix. If you're in some sort of pain that's not chronic, we can address it, but it's not to treat chronic pain. So that's where we get into trouble with patients coming in for chronic pain things and wanting medications that really just mask their improvement in their health and life. Pain medicine isn't for long-term use unless we're looking at cancer patients or other critically chronically ill patients that do need strong pain medicine. It can be a huge problem. We're not really fixing the problem, we're just masking it with some pain relief.
Apparently, in the 90s, pharmaceutical companies started to provide us with more access as providers to these opioid medications for pain. They reassured all the medical providers that there was no addictive potential in these drugs, and it led to overprescription of opioid medications. Opioid medications can include just pain relievers, it can include heroin, it can include fentanyl. Fentanyl is a patch, and it's also in other forms as well that can cause significant addiction. And we've now learned that because we've seen that people overuse these drugs not just because of pain, but then they become tolerant to them. In the statistics from the NIH, the National Institute of Health, says that about 29% of patients prescribed opioids for chronic pain misuse them. They say 10% of people who misuse them eventually develop an opioid disorder. And approximately 80% of people who use heroin were originally first misusing prescription opioids. So this is a real issue.
Wow, those statistics are crazy when you think about it.
Yeah.
In researching this as well, we've been seeing a rise every year on the number of deaths related to opioid overdoses. And I think last year we're at 192 deaths per day of opioid
That's
overdoses.
Just staggering.
That's
obviously like more than I would ever, patients I would ever see in a day, but that's in the whole country. You can't imagine that just being the reality.
And researching this a little bit more too, I've looked on several government sites, and one of the government sites on the United States Health Resources and Services Administration, they have solutions to how they're addressing this, but there's really no answer. There's no answer. Like, how are we going to fix this problem? What are we doing? There's several steps that they're trying to take to. They see it as a huge crisis, but there's not like a answer.
Yeah.
There's not a specific answer.
What's the alternative?
We're kind of trying to learn more training on not prescribing as many opioids. We're going to try to address this, but there's no clear picture of what we're going to do this year to make sure there's not that many deaths next year.
Yeah. Well, I noticed that when I was working in the emergency room up in Temecula, California, and then I also started to work in a regenerative medicine department in a wellness clinic, I found that we were able to diagnose the person's cause of their pain, treat the cause of their pain, and get them pain-free within a matter of weeks or months, depending on their condition, where they weren't even needing a pain management doctor anymore. They were no longer in pain. And I thought, maybe we're onto something. Maybe this is the answer. And now we are here 5 years later, where we treat people Monday through Friday with non-narcotics. I mean, I can't even remember the last time I've written an opioid prescription for Norco or morphine or any pain medicine. I mean, patients get their pain treated then they go away and they're living their lives. It's kind of a thing that you think is too good to be true, but yet I think it's just a real unknown in most people's lives. They don't know this is an answer. They don't know this is an option. They don't know that there can be an alternative for them.
Along with the 192 people dying per day, it's also a huge financial burden. In the United States, it's $78.5 billion per year on how much it costs for opioid crisis, like addiction overdoses on the healthcare. So it's a huge financial burden.
Yeah, it's completely avoidable
Yes.
if people's pain was addressed appropriately. While we look at the cause and try to find the source of what's causing their pain, a lot of times it's these nerves that we're talking about. Regenerative medicine can include hydrodissection, and it can also include other types of stem cell therapies, PRP, exosomes. Even there's some peptide therapies like BPC 157. These are all different options that are being offered by companies that we know and trust very well, and the supplies are being offered in a very safe way, with FDA going in and evaluating these labs and providing them with the guidance that they need to get their approval process. So it's really a process that's taking time, but the answers are available here and now, every day, if somebody does seek it out. And once they know that there's an option available, they may not need to continue the wheel or the cycle. That's a struggle to fight. I know my brother even was fighting against the enjoyment, the high that he got from using opioids when he had his hip surgery. He had some extra medications, and he would just take them when he went out to play football because he could be invincible. And that feeling, he said, was a little scary. After he got, off of those opioids, or when he was trying to avoid using them as often, he got his regenerative medicine treatment in his hip, and he was able to live pain-free, and therefore the narcotic prescriptions that he was getting were no longer needed. And
luckily he didn't get into that addiction crisis, which many people fall into.
So close, yeah.
Definitely.
So many people can just be a little bit too close to the edge, and then they find themselves where it's too hard to get out. So catching it early, we're on the side of regenerative medicine, but it's a very preventative thing because it prevents sequelae of other events that happen. So I would say that regenerative medicine may have a good shot at being the answer to the opioid epidemic as an alternative to chronic pain management here in the United States.
And I think that's where people are misled. Opioids and pain medications are just a temporary fix. It's not something that it's not going to fix your injury. It's not going to heal you. It's just to get you through the hump of getting over that pain, and then we're really looking at trying to fix the problem. And that's what we do here at Regenerative Medicine. We look at fixing the issue, the pain source of what, if it's an injury or a torn tendon or whatever it is. We look at fixing it, not just masking it with some pain medication so you become addicted, and then your life spirals into this crazy thing. So that's the main thing. People are misled that I need something to treat my pain. Well, it's a temporary fix to treat your pain. We can treat anybody's pain, but managing it long term and fixing the cause of the pain, that's what we need to focus on. And that's where the public and us as providers really need to be educated, and we need to be aware that pain medications are just a temporary, and there's other alternatives to fixing your issue. And that's what we do here at Regenerative Medicine. We don't really offer you the pain medication just to mask it. We offer you a fix to your problem.
I had 3 people contact me just within the last 3 days about sciatic pain, and they said they've been dealing with it. So one girl has been dealing with it for almost half her life, since she was 16 years old, and she just mentioned that she really didn't have another answer, that the providers that she saw were giving her, some ibuprofen, take some muscle relaxants, and then go to some physical therapy. And, if it gets bad enough, then we'll give you an MRI, and then we'll be able to give you a neurologist referral, and maybe he'll send you to pain management once he does some nerve testing. But what I found was that, through all of that, she still was in pain. After all of those processes that she jumped through, all these hoops, she was still facing the same radiating pain down her leg. And so I told her about some of the case studies that we've seen really have a turnaround. I mean, she actually was referred because one of her friends had sciatica and came to us and got relief. Simple procedure that we actually treat the nerve called hydrodissection. So it's basically taking the pressure off the pinch, off the pinching off the nerve, so the nerve can move freely, like a deep massage. So massage typically takes the pressure off the top when you're treating it from the outside, but then the pain comes back the next day because the muscles get tight again. And what if you could actually treat the nerve from within in a 360-degree treatment with just saline, just fluid water, really. So we're basically just using a needle, using ultrasound to guide the needle to the right place, and the hydrating, or opening up all the space around that pinched nerve, pressing the fascia and the tissue and the muscle away from the nerve so the nerve can move freely.
And that's what's causing your pain, right?
Yeah,
That's why people are having pain.
Exactly. The nerve that is pinched is sending a signal to the brain that says, ouch, this hurts. I don't like to be compressed. I need my oxygen. I need my blood supply. So by giving it back that space that it needs to survive and allows the blood supply to go there, it's not like, when you like compress your finger and then it starts to get all purple? Well, that's like compression. And if your nerve is compressed, eventually it's going to cry out and say, hey, take care of me better. Get that pressure off of me.
And that's where I see that happen frequently. I don't know the statistics, but I think back pain is like in the top pain issues in the United States.
Yes.
I think back pain is huge up there, and we see a lot of people that have, your back is, you're using it, you're doing a lot with your back every day, standing, bending, anything you do. So we see that happen frequently. And the case that you described sounds really similar to what we see in the ER. Unfortunately, you have to go through hoops. You have to see your primary doctor. You have to have an MRI. You have to have X-rays. You have to be NSAIDs long term, and NSAIDs can kind of cause your stomach to be upset if you're on the long term, or you can have some issues from that. Then it's muscle relaxants. Well, a lot of us can't function at work, and we all have busy schedules, especially living here in San Diego. To be on a muscle relaxant, for the whole day. So it sounds like a typical case, and I'm glad that you guys were able to help her.
When you're pain-free, you can then do more with your life. You can feel
be
like
more active, and we see a lot of patients, wide range of ages, from younger to old, and they're still wanting to be active and fit lifestyle, and do what they were doing 20 years ago. So we give them the best options with some of our treatments here.
Yeah, and I know when I'm in pain, I'm a pretty miserable person. So if we feel like regenerative medicine has the potential to be such an awesome solution and an answer to the opioid crisis and pain management, what do we think are the barriers? Why are more people not getting this treatment?
Well, I think one we kind of already addressed is not enough people know about us. Not enough people are aware of our practice. It's not in the traditional side of medicine. So if you go to your primary doctor, they're not probably going to tell you about us. That's not what they're trained to do. We're an alternative to traditional medicine, and a lot of people just don't know about our practice. They don't know we're out there. So that's kind of where we wanted to start doing some of these videos and just make people more aware there's other alternatives other than just traditional medicine and just masking your pain with medications.
Yeah, and you mentioned a really good point the other day about the medical business financial dilemma.
Unfortunately, anytime I hate to go back to this, but medicine is also a business. I mean, hospitals are a business. They're there to also make money. You have to just, as a patient, protect yourself. Knowledge is power. So if your doctor tells you one thing, do your own research. Same when we give patients information, we don't push any treatments on them. We give them all the knowledge and everything that we're offering them, and then they can make an informed decision on their care and their treatment without making them forced to do so. So I just think, as a patient, protect yourself, be your own advocate. Doctors will give you information, they're going to give you their advice, and that's what we do here as well. We give you our advice, we offer you alternative to maybe not having the need for surgery that you're needed to have. I don't know how many times I've seen that with some shoulder injuries that we've had come in where nothing, this is no disrespect to other practices or other physicians or anything. They're just doing the best and giving their patients the knowledge that they think is right. But we're also seeing these patients, and we give them injections, and then they come back and they don't need the surgery. Their pain is relieved, their mobility, everything is improved. So they just save themselves from having to have surgery.
And the cost barrier, really, I toy with that one a lot, because I think about how I want everyone to be able to reach this treatment and come today and have their insurance cover it, but we're not quite in that environment yet where cash is still the best way to access these services and insurance coverage isn't there. Thank goodness a lot of people are finding HSA, their health savings account, or their FSA, flex spending accounts, to be able to put money in advance and have tax-free finances to be able to cover the services that we offer. And then I think about the cost of repairing my car, and I realized that, oh wow, repairing my car last year was basically the same cost as repairing my shoulder would have been in the clinic. So
Oh wow.
it's really like really not out of the, I don't want people to find it to be, I don't ever want to make our prices at the point where it's like so much more.
unaffordable to people.
Right.
I think, that is also things that insurance doesn't cover. You got to think about, you go to the clinic, you have a copay. You go to the ER, you have a copay. You go to get a prescription, you have a copay. So not, even when you go in traditional practice, there's still expenses. You have surgery, you still have to reach amount of money that you spent on that surgery.
Sure.
You get hospitalized, same thing,
There's still a bill.
So you're always paying for your health care.
Yeah.
We just don't, we're just not at a place where we're doing insurance, but also too, our prices aren't, crazy where people can't afford them. And what's the price of your health? What's your price of your function and your pain relief?
Sure.
To me, it's priceless. I mean, I'm not a millionaire, but I would be willing to shell out some money to have better functionality and mobility and pain-free and live a quality, more quality, higher quality life. And I get out and be fit like I normally am. And so to me, it's, I'm willing to invest in myself, invest in my health.
That's a really good way to put it. Investing in your health, investing in your future.
Yes.
Great. Thanks, Kim.
Thanks.